is, cla- is classified as you can see. So we have orthopedic examination, we have vascular lumps, neurological, respiratory, cardio, and this. Yeah, Muhammad, they need like an introduction.
Okay. We have 3 station examination in the exam. The examination station mark is 20 marks, 8 marks for maneuver and technique, 4 marks for communication skills, and 4 marks for professionalism, and 4 marks for discussion. I think this is the easy mark, you can handle it. Okay, the key strategies is maneuver skills. Please adhere to standard examination protocol consistently. Understand the purpose and interpretation of special tests, as Lachman test in the knee joint examination and other special tests. Communication skills, establish a positive rapport with the patient through smiling, maintaining eye contact, and monitoring the patient, and mention the patient name a couple of times. Apologize for any discomfort and offer solution where appropriate. Provide clear explanation for each examination step. As when you wanted to do Lachman test, ask the examiner now, I will start by push your knee joint forward. And this may be a little bit uncomfortable. All right. Tool using, clear explain the purpose of any tools. As when you examine hip joint, you need a tape. Tell the stimulator this is the tape. I will do some measurement in your side. Don't use any tools without explaining to the patient. There are explanation of examination approach. To introduce yourself as, hello, my name is Muhammad. I am one of the surgical doctor. I would like to examine your knee joint as example. The examination include me looking, feeling, and do some special tests. Is that okay with you? Here, you take your permission. Then explain the area you need to examine for exposing. Okay, Mr. Jack, could you please expose your knee joint from feet until the middle of your thigh? All right, during examination, if you feel any pain, please let me know and ask for a chaperone. Don't forget this. Okay, Mr. Jack, do you need any chaperone to attend this examination? This is the examination approach. You need to master this. Introduce yourself, take permission, expose the patient, ask about the chaperone, tell the stimulator if he feel any pain during examination, please let me know. In the conclusion, thank the patient, assess with readdressing. Okay, Mr. Jack, here we finish our examination. Do you need me to help you readdress? Is there anyone have a question about this approach?
Okay, that's clear. We're gonna add this approach to the school in general.
Yeah, I added already.
Yes, and yes, well, if you open the introduction on the school, there is introduction overview, and there is how much is the communication skill, 4 mark, maneuver and technique 8 mark, as Muhammad said, and then practical tips and professional conduct, and we will start with the orthopedic examination. Who is doing the orthopedic?
Knee joint, Muhammad? I think for Muhammad Kamal. Are you ready?
Ready, my friends. Should I open the camera now? Should I start?
Yes. Cool, yes. That's fine. And will you examine yourself or? Oh,
that's my son. He's here. I didn't find even I have to buy him.
What's his name?
Nice to meet him.
Can I speak with him? Let Muhammad.
Yes. Who's one? Me or Muhammad Abikir?
You.
No, you اسمك منو؟ اسمك منو؟
عمر اتكلم معاه سوداني هو اتكلم.
عمر. نعم. عمر انت موافق انه ابوك ده يعمل معاك اكزامينيشن ولا ما داير؟ Okay, that's cool. I think there's no other way to do it around. So Umar gonna be your patient. But Muhammad Kamal.
Yes.
Are you happy for this to be published or no?
Ali, I think I can. Well, say I have the choice to answer, or is it obligatory or not? That's the question.
No, you have the choice. We can cover it. We will find a way. No
عمر
worries.
انت
It's just for your benefit.
I will ask my son himself.
فرق معي.
انت عايز تكشف يعني الكشف ده يكون عام.
عادي ما تفرق.
My yes, for me is for public health. It doesn't matter. We all doctors. But if there is any
Look.
editing,
No. Okay. Well, I'm not gonna publish it. For
because
now.
actually, I feel free, my friend. I'm a doctor, but I don't know in the
We will
future
not
is
publish
it
it.
okay or not.
Muhammad, we will not publish it.
Yeah.
inshallah.
We will not. I don't think. Yeah, we are here to make you benefit as much as we can. So I don't think the examination will be. We're going to talk about this, Muhammad, later. I don't think the examination is appropriate to be published.
Yes.
Well, it's totally different than the rest of it.
Yes.
Before
So
we
I
start,
asked
Okay.
about
before we
recording.
start, doctor, I want to feel sorry that because still I have infection. I may have cough, and he's
That's
also
fine.
he may have cough. Deeply sorry. Deeply sorry.
That-
Hope you speed
that-
recovery. No problem.
That's okay. Let's put the timer. You reviewed it from the school, right?
Yeah, of course.
Okay, now you can start.
Okay. Good evening, Mister. My name is Dr. Kamal. I am one of the surgical doctor working here. Would you please address for me your name and your age, please?
My name is Amr Adwani. My age is 10 years old.
You are 60-year old. Nice to meet you, sir. Today, I'm going to do knee examination for you, including looking, feeling, and see your movement, and we'll do some tests. Is it okay with you?
Yes.
Okay. First of all, do you need chaperone?
No.
Okay. Now, I want to take your permission to expose your knee from the foot up to the mid-thigh. Is it okay with you?
Yes.
Okay. First of all, sir, I want you, Mr. Edward, come close. Come. I want you to walk from here up to the end of the room. Gently, I want to examine you from behind, side, and in front. Is it okay with you? Go ahead, my friend. Okay. Thank you so much. Would you please lie down? Lay down. If you feel any pain during examination, please let me know, okay? Now, okay. First of all, I can feel, I will do examination for your knee. I will expose the knee up to the mid-thigh. First of all, we're gonna see the temperature of it by both hands. But actually, I have taken the phone with my hand. Okay.
Okay, no problem.
Okay, this is good temperature. There is no deformity seen there. There is no valgus or varus deformity. Okay. And secondly, when you do palpation examination of the knee, please lift your knee up, right knee. Okay, put it down. The left knee, lift it up, put it down. Okay, lift your right knee up and the left knee. Okay, when you do palpation of the knee, when you see the quadriceps tendon, the cruciate ligament, the tibia and fibula, the tibial tuberosity, the patella examination, and the popliteal fossa for the right knee, and also we will do it for the other knee, the left one.
All right.
Okay. Gently. I want you put your knee down, both knee, okay? Now we want to do examination to see if there is any effusion in the knee. We want to do milking test. We want to do patella cross fluctuation. We want to do patella palpation. You have any pain? Do you feel pain, my friend? Mr. Edward, do you feel pain? Okay. Brilliant, brilliant. You're doing very well, very well. Do you have pain in the knee now? Oh, sometimes you have pain. Okay, okay. Now, in such a case, after that, we want to do fulfill the examination of the knee. I want to use the tab, my friend, Mr. Edward. want to examine your muscle. Is it okay with you? Use the tab from the tibial tuberosity. Tibial tuberosity from here.
If Umar can hold the phone, he will help you a lot.
Okay. Okay. Tibial tuberosity from
This
here.
is a maneuver side.
Sorry?
Give the phone to your son. Give the phone to your son. Let him, yeah,
Okay.
let him record you.
We want to see the maneuvers. I think
Okay. Want to see the tibial tuberosity from here. Want to see the quadriceps muscle assessment, 10 centimeter from here. And again, want to see the fullness of the muscle. Okay, this is the right quadriceps tendon. The other one. ركز الصورة. Tibial tuberosity, slight flexion, 10 centimeter from the tibial tuberosity for the muscles. And again, full circumference of the muscle. Okay.
Ali, mute yourself, please.
Sorry.
No, Ali, mute yourself.
And after that, excuse me, Mr. Edward, we're gonna do some tests, special tests for you. Is it okay to do it for you? Okay. First of all, we wanna do anterior and posterior drawer test. We wanna flex the knee 90 degree up here and there. Before that, beforehand, I want you elevate the knee, the left knee, put it down, elevate the right knee, put it down. Now, elevate the right knee, push your right knee against me. Okay, flex your right knee against me. Want to see the flexion and extension, passive and active movement. Okay, the other side, elevate the left knee. Okay, push it, push. Flex your left knee. Okay. And after that, we're gonna feel any crepitus. Mr. Edward, want to do a special test for you? Is it okay with you? Okay. Want to do anterior and posterior drawer test. Elevate your knee, 90 degree. The left knee, 90 degree. We're gonna hold the knee. My finger is there. Okay. Now we're gonna push anteriorly. Wanna push the leg, the foot anteriorly.
Time pass.
Pressure against the
6
knee.
minutes pass. 6 minutes pass. You have 3 minutes
Okay.
for the discussion.
Okay.
I can give you 40 seconds for a single thing if you want to do it. You have 40 seconds. Do you want to do anything?
Just I want to complete just the examination.
40 seconds.
Okay, the other one.
Yeah.
Okay. Okay. I want to do just the valgus posterior, valgus and varus test. Open the knee. And a flexion like that. Flexion. Other one. Other one. And posterior, second side, but like that. The other one. Okay.
All right.
I'm gonna do meniscus.
Okay.
I'm
Fine.
finished.
Can you present your patient, please?
Okay. My patient, Mr. Edward, he's 60-year-old. He is feeling knee pain. And this happened after, as the scenario, we do examination for him. He has right knee pain. And during examination, we have there is a restrict movement of his right knee. The anterior drawer test is positive. The valgus, the posterior, the valgus stress test is positive. And there is also restriction movement of his left knee. And he has antalgic gait movement.
That's fine. What's your differential diagnosis, doctor?
Right MCL injury, right cruciate ligament injury, right meniscus injury, combined injury, or could be osteoarthritis.
All right. How to manage this patient?
I have to do a full, thoroughly examination through his knee. And after that, I have to do, for orthopedic examination, I have to do examination for him. First of all, we want to do weight-bearing X-ray, anteroposterior and lateral of his knee. want to do full examination, complete general investigation, full blood count, C-reactive protein,
All right.
erythrocyte sedimentation sheet, and MRI.
And what are the signs of osteoarthritis in the knee? X-ray.
In the X-ray, we can find subchondral sclerosing, narrowing of the joint space. We can have cyst. We can see cyst, and also we can see narrowing joint space, osteophyte.
All right. And what will you look at in the MRI if you did an MRI?
We want to
Time is
see
finished. We're going
the
to continue
integrity of the
question.
meniscus and the shape.
Time is finished, but we're going to continue the question. Yes. And what is your treatment?
Treatment, non-surgical treatment first. We want to do conservative treatment. We give him painkillers for his pain. We want to do compression bandage for his pain. We want to do exercises for his knee. We want to do elevation of the limb up to the heart level to increase inflammation, and that's all.
That's the non-operative one. Okay. What's your operative
Non-operative.
choices?
Sorry?
That's the non-operative choices. What's your operative
Yes.
choices?
Arthroscopy.
All right.
Okay. Fine. I think
Yeah.
that's good. There's another scenario. All patient have pain in his right knee. In the examination, you may find crepitus, which indicate osteoarthritis. In the
Yes.
management of osteoarthritis,
Yes,
you have conservative management.
We have conservative.
You
Sorry?
have,
Sorry?
Okay.
Yes.
yes, you have.
We have non-surgical and surgical. We have non-surgical. It is we want to give him hot
Yeah.
heat implantation. We want to
Yeah.
do a bit of his movement, his tolerate exercises. Okay, but if there, sorry,
Okay. And what's the medical intervention?
if there is medical intervention, intra-articular steroid injection.
And what's the surgical options in that case?
In the surgical option, we may do arthroscopy, which is arthrocentesis, or with realignment of partial or total knee replacement.
Good.
All right. Ali,
Okay. Yes, Mohammed.
let me comment first because I have poor internet connection. I fear I might lost my connection
All right.
anytime.
Sorry for examination, my friend, because I only use
Oh,
one hand.
yeah.
You did very good, Muhammad Kamal. Just I will start with you from the beginning. You introduce yourself, but I think you forget about the chaperone.
No, I ask him.
Yes, good. Also,
Yeah,
you need
he
to
asked.
offer a painkiller because the
Yeah.
patient have a pain.
Yes, because I asked him, he forget the scenario. I told him, say pain, he said no pain. That's why.
Okay, that's fine.
Yes. So you need to offer a
Yes.
painkiller if the patient having pain. Also in the look,
Yes.
feel movement. I go through all this. Look, when ask the patient stand here, please, in this spot, assess looking for direction from in front and behind and from both directions. All right. When you come behind, ask
Did
the
you
patient.
understand this, Muhammad? Muhammad, wait a second. Did you understand this? So this you did the knee of your patient. You look from this side, and you look from this side, and you go from this side, and you go from the back.
Yes.
You let Umar just to move around, but I don't think you inspected all the angles. Yes, Muhammad.
But when
continue.
we come back, ask the patient that I will take a look from behind.
Yes.
Okay.
Take-
Okay.
In the feeling, you start
This for
by
all the orthopedic.
yes. In the feeling, you start by check the temperature, which is a good thing, and tenderness, and then you need to put the milk test and patellar tapping test here in the feeling.
Yes, I have noticed in the it was button after the
I think you put
the
it after
examination
the
of the
movement.
crochet. Yes.
But it will be fine if you put it during the feeling.
Okay, you mean after temperature, after feeling temperature, you do the squeezing,
Feeling,
the three type
Tenderness,
diffusion.
then milking test and tap test.
Okay,
Okay.
I have said it
Also-
also, but I have
also-
put it beside. Yes.
Also,
yes.
you need to explain to the patient, this is the tape. I will do some measurement in your thigh.
I asked him. I told him now. I asked him. I have
Okay.
taken his permission.
Perfect.
Yes.
In the movement, I think you do the passive active movement later on.
What do you mean? I didn't understand. Would you please explain
the
more?
movement have two aspects, which is the passive movement and the active movement. You need
Okay.
to ask the patient, could you please bend your both knees at the maximum point that you can?
Okay.
And
I asked
stand
him,
it.
but I didn't say maximum point. You are absolutely right.
Yes. After that, could you please relax your both legs? I will do all the movement.
Okay.
All right. In the special test, in the knee joint examination, we have 5 special tests. Posterior sac sign, I think you forget doing posterior sac sign.
I actually, the time finished exactly at posterior sac sign. That's
Yes.
why I didn't say posterior sac sign, but I have do it.
Yes, posterior sac sign and anterior drawer and posterior drawer
Yes.
test.
And McMurray and
Yes, in
the
the
valgus and
anterior
varus stress test.
And posterior
Yes.
drawer test, ask the stimulator to put his both legs together and take
Okay.
permission that you want to sit on your feet. And it fits, okay? Okay.
Would you please
As-
explain it more?
Okay, Umar, could you please put your both legs together? I will sit on your feet
Okay.
and I will gently push your knee joint forward and backward.
Okay. This is first time because I didn't do it knee examination. That's why.
Yes.
Yes.
Okay, fine.
Good.
After that, valgus and varus stress test.
Yes. Yes. Already,
You
I'm
do-
trying to do it fastly because he said 40 seconds.
Yes. And the last one is McMurray test. The
Yes.
last
For
thing,
meniscus tear injury.
if the ring bell, tell the stimulator that, do you need me to help you readdress? Thank you for,
Yes. I forget
yes.
this. Actually, I forget this.
yes.
Say that again, Muhammad.
At the end of the examination, tell the stimulator, thank you, Mr. Umar. Do you need me to help you readdress?
Oh, yeah. At the end, yes.
Yes, I forget it because
Okay.
he said time is finished. That's why I was confused. Yes.
Yes, that's fine. I just want to add a couple of points. You know, that's the normal of the examination. You will never feel satisfied from every single recitation. Even if you did it well, you will have that feeling that you didn't do well. So that's normal. That's very thing. There's no examination stations that will be easy. They're all difficult. Okay?
Okay.
When you ask him to walk, it will be it would be a very gentle movement if you went beside him, like
Yes.
not to fall.
Before that, Ali,
Okay?
I remember a point about walking aids. Ask the patient, do you use any walking aids?
Yes.
Yes, it was written in the school. Yes, you are right.
Yes. Then walk until the end
So-
of the room.
Do
Totally
you
agree.
use
It's written
do
in the
you
school.
do you use
Fix. Yes.
do you use walker aids like Zima
Yes.
or not? If you're walking, then you go by him like this. You go and you put your hands right and left with your patient. You-
Yes, that one
you-
comment actually because I have seen videos in YouTube. One of them is geeky doctor.
Humidity.
That's why I did. He didn't. This actually you put this in our ENT discipline. We put this in the Antenberger and Turger. First time to see something like that. That's why.
Yes, that's fine. And I don't think you did the milking test right. You need to because you're holding your phone, right? You know you need to use both hands.
Ali, could
for
you
the
please
milking.
open
Yes,
the
that's right.
share?
I'm trying to do it, but I
I
was
would like
holding
to
my
share
phone.
some special test.
Yes. Yes, both hands. Yes, but I have holding my phone. I'm trying. Yes.
I need to share,
All
Ali.
right. Give me a second. Let me just.
So
Yeah, you can share now. And for the rest of the group, yeah, I just want to add a couple of points. For the pain, when you touch, you ask about the pain, which is good. But I think Muhammad, you did over explain. Like you explained a lot to the patient. I'm gonna use this tape. You explained well, but it was a bit ما زاد عن حد انقلب إلى ضده, right? It was a bit.
okay, not to explain.
No, you need to explain. You need to explain, but
Yeah.
like quite a bit less. Yeah.
Okay.
And what else? What do we have? This one of the examination Muhammad did.
Yes.
Muhammad, what do you think about this examination? Can we provide this for the people with us? We need
Yes.
a permission from Bakr
Yes.
Sadiq.
Yes. But I need to modify it, Ali. Give these guys a clue about
I
the
can give a
examination.
suggestion. For me, it's free, my friend. I am not complicated. But just
No.
please, I ask you one benefit. Please let us see the video before you edit. Before you.
No, he talked with me, Mr. Muhammad.
No. Just give you my opinion. It's up to you.
Yeah. No, we will not publish your video, your examination with your child.
Yeah. From
This is the negative. What about the positive sign?
what do you mean?
You said this is the negative. This is my mistakes. What about the others? Okay, I'm asking you. Okay.
The positive look, your examination was very confident. You didn't forget anything. You answered all the questions right, and you did everything that this is a pass for the exam. If you perform this
Thanks.
way, you're gonna pass the exam. So I just want to mention for everyone, when we speak with you guys, we just put the negative, but we don't speak about the positive. Like when we evaluate you, it's like in the religion, you just tell about the haram thing, right? Alcohol
Yes.
is haram, but you don't say banana is halal, mango is halal, meat is halal. We just mention the negative so you be aware of, but there's a lot of positive.
Actually, I appreciate you and your doctors so much. I appreciate your notes and your
That's
comments.
our pleasure.
Okay.
Okay, so
Did a quick
should we go to
review
the next,
about
Muhammad?
Ali. You see the screen?
Yes.
I will
Yes,
give you
I do.
quick review about the new examination.
Yes, we are ready.
Yes.
Yes.
So I will speed the video.
During the examination, you need to expose your lower lips till the thigh. During the examination, if you feel anything, please let me know. Okay? Do you need any chapter to attend the examination? Okay. Could you stand up for me, please, in this spot? Yeah. I'll start by taking it, right?
Do you see when he sees from the side?
You take
Yes,
permission
yes,
from go
yes.
behind.
No, take a look from behind, right?
You know, Muhammad. Okay, Muhammad, look, listen.
Yes.
This is gonna take a lot of time. I know you have all these videos. We need to modify these videos.
Okay, all right.
Take permission from Bakr Sadiq and then send it to our group. You know what I mean?
All right.
That's fine. We need to modify them first. Okay?
I appreciate it. Thanks, Doc.
Okay. Who's next? Yeah, before we go to if you have any question, please send it to our group. Muhammad Kamal, I'm sure you studied it from the school. If you have any point,
The next
you want
station
us
is ankle examination.
Muhammad,
Okay.
yeah, I just want to say one point real quick. If you have any point, please send it to me so we can improve the school. If you have any idea about the videos and how we can write the school, let us know. It's
Sure,
your community.
Of course.
So when you review your station while you're reading from school, send us message. Please do this. This you can make this symbol. You can add to this. All right. Next. Yeah, next, Muhammad.
Next examination is ankle examination with HK.
Yeah,
Who is HK?
in the group?
Who is HK? Khawla, I think.
We should have the name, right?
Yeah. Let me check. Hind. Where is the Hind? Hind. So we'll go to the next session with the shoulder joint until Hind joins.
Muhammad, okay. Muhammad, we just need to make sure that those who gonna choose any station, they make sure they are attend.
Yes.
And I never heard of him before attending one of our meeting, by the way.
Yeah.
This is my first time.
Yes.
Okay, Haji said she's gonna do it. Now everyone can feel comfortable. We are not publishing any videos from this. We're just gonna keep it.
Hajir, you're gonna do hip joint examination. All right.
Yeah.
Okay.
Okay.
Now you can, Ali, put a time, Ali.
Yeah, let me put the time.
So
Yes. Start, yes.
Okay. Hello, I'm Dr. Hadi, one of the May I confirm your name and age, please?
My name is Priya. I am 14 years old.
Nice to meet you, Priya. Today I'm going to do for you hip examination. This includes me looking, feeling, and do some special tests to. Is that okay with you? I'm going to look from all directions to see our performance of other things. I'm just going to go behind you from this side. Okay, yeah. Do you use anything help you in walking? Can you walk to the end of the room and come back? I can assist you. Yes. You can come back. Yes. Thank you, yeah. Now can you lie with the couch, please? On the side. So yeah, I'm going to see the picture of the hip joint, and I'm going to test the area around the hip joint. Okay. Starting by conviction. If you feel any pain during my examination, please tell me. Okay. Then get your hand first. Okay, yeah. This is a tape. I am going to measure the length of your legs. Okay. Starting. Here we have to expose you from the hip joint to hip, but I'm not going to do this this station, but we have to expose
Alright.
this area. Okay.
Continue.
So yeah, can you bend your hip joint? Can you bend it? Okay. Thank you. Can you make it from left this side to the wall side and break it down? Can you take your hand back laterally? Yes. The other one. Now you can feel free. I am going to do those movements by myself. Okay. Start by flexing your arm from this side. Yes. Do you feel any pain? Are you okay with that? I should bring the patient to her back to see the hip extension.
All right, escape it.
Okay, yeah. I'm going to do some special tests for the hip joint to see what is the cause of pain. Okay. Can you flex both your legs to the maximum? I'm going to put my hand in your back if there is any pain. Okay. Can you flex the upper down? Take it down. Yes. You feel anything? You are very cooperative with me, and that is good. And this time I want you to put your foot in your knee. Yes, I am going to press a little bit here. You feel pain? Thank you, Miriam. You can get out. Help me to close. Now you can sit down.
How many minutes remain,
Okay.
Ali?
2 minutes.
Do you want to do anything?
You still have 2 minutes.
Okay, I do hip examination for my
No,
patient.
no, no, not
Starting-
presentation.
No, I mean
Do you
like
want to
you
do
are-
anything in the examination that you missed?
You still have 2 minutes.
You want to present your case?
Okay.
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 What's the time of your presentation?
Yeah, the time is already on.
Okay, I have conducted a clinical examination of a female hip joint presented with right side hip pain. She have an antalgic gait and scarf over her left hip, which indicate that she may have an surgical interventions. She has decreased range of movement of her hip. Regarding her Trendelenburg sign, it was positive, which indicate weakness in her hip abductors. And the Thomas test was positive, which indicates a flexion deformity.
Yeah. All right. What's your differential diagnosis in this case?
Okay, my patient present with right side hip pain, and she have anterior gait, so I may put superior gluteal nerve injury on the right side. Or
Okay.
may she has osteoarthritis, which cause her the flexion deformity. She may has pseudogout or gout, rheumatoid arthritis, also inflammatory or infective arthritis.
All right. How will you investigate this patient?
I will start by blood investigations, including her full blood count, CBR and ESR, and imaging by doing hip joint X-ray and MRI.
Okay. What's the causes of Trendelenburg gait?
It has many causes, including mixed fracture leg of femur, maybe developmental dysplasia of the hip, or superior gluteal nerve injury.
All right. And how to treat such a patient in general?
Generally, I have non-operative measures and operative measures. Regarding the non-operative measures, I will advise her to reduce her weight, and I will advise her for regular exercise. Also, she needs
Okay.
physical and occupational therapy and medications. I shall put her in simple analgesia, like regular paracetamol and as needed non-steroidal anti-inflammatory drugs. She may need an intra-articular steroid injections. Regarding the operative,
Yeah.
yes, she may need arthroscopy.
And there's another treatment that we didn't mention in the school, which is
I don't know.
total hip replacement one of the choices if it's very severe?
Okay.
Yes.
Is total hip replacement one of the choices?
I don't think she needs total hip replacement unless there is a very severe deformity to her hip.
Yeah, if she's in like in severe cases.
Yes.
All right, good. Muhammad?
Hadir, I think you did very
Yes.
good. Excellent. I would like to go through examination from the introduction. Introduce yourself, take permission, ask the patient to expose the area that you need to examine. In looking, you look for all direction, and you ask a patient about the walking aids, and you examine the patient gait. Did you do the Trendelenburg sign?
No, I didn't. I didn't do it.
This is a crucial point.
Okay.
Do you know how to do it?
I think I should put my hand on the superior iliac spine, then ask the patient to lift one leg, then the other one.
Yes, and how you can define where the Trendelenburg sign, whether in right or left leg.
Yeah, I'm not sure. It's my
Yeah,
first time.
you can
ever
ask
use-
the stimulator to put his both hands in your shoulder, the right hand in your left shoulder and the left hand in your right shoulder. Then ask the patient to bend his knee joint. The area that you feel the pressure, the same area that affect the abductor muscles of the hip joint. You know it?
Okay. I will get it, yes.
Yes. All right.
Do you see here? I'm searching. I'm trying to sorry. So look here. Look to this picture. So the size that drops.
Which means there is weakness in the muscle. This is the positive Trendelenburg test here.
Yeah, the weakness will be on the opposite side, not on the side that drops. The side that drops is the normal side. The side that didn't drop is the abnormal side.
Yes.
Yes.
That's a very important point. Okay.
In the movement, you did the active and passive movement. I would like to ask you in the special test of the Patrick's test, you will ask the patient to put his right ankle in the left knee and where you want to press, in the hip joint or in the ankle joint.
I think in the hip joint.
No, in the ankle joint. So this is a lateral rotation. And ask the patient, if you feel any pain, please let me know.
Okay.
All right.
Yeah, Muhammad, I think Salma Zahran asked a very good question. What about reflexes in the exams of the hip and exams of the ankle? There's no time for it, but I just want to know, like, how should we?
Reflexes in the hip joint and knee joint?
Yeah.
No, it's not recommended. It's not a neurological examination to do reflex here. Just in the back and the lower limb examination as patient having diabetes.
Back and the lower limb examination.
Yes. And all
But
neurological examination.
Or neurological, the orthopedic, yeah. What about the sensory? Motor function is we did say it, but what about the sensation?
No.
Sensation is simple. You can just touch, close you close your eyes and just touch his leg and tell me if you feel it. So
Yes.
Salma,
Here we want to figure out
regard
any trauma, osteoarthritis,
yeah.
non-neurological disease.
Salma, in regard, yeah, I just want to answer her question very clearly. There will be no time for you to do the reflexes. If you had time, then do the reflexes. You will not be harmed. The reflexes is for back pain and neurological symptoms.
Yes. But overall, how you did very good. Thank you.
I like this question. I want people to comment this way, so we want to make sure everyone on the same side. Okay. Should we go to the next? If you have any comment, any question, please ask in the. I'm following the.
Ali,
the chat. Yeah, Muhammad.
I would like to mention when the examiner asks you, could you please present your case? Please mention the positive sign first. You have no time to mention there is no, there is no.
Yeah.
Mention the positive signs.
Yes, of course. You start with the negative we start with the positive before the negative.
Yes.
Okay, everyone.
The next station is
and look, we are here. We are just providing guidance. I want everyone to practice on his son or his daughter or in his brother or sister. And you don't practice one or twice. You practice a couple of times, and you record yourself. You record yourself, and you review yourself later on. We will modify the videos that Muhammad already have and provide it to you after we take permission from everyone involved.
Yes. Back then.
Who's doing it?
It's me, Sahar.
Sahar, please offer painkiller from the beginning. All right.
Okay, let me just make sure كده ظاهر.
Yes.
If not,
Yeah, she's in a proper hospital setting. I think we need to upload this.
Yeah.
I'm on call, so we have to make it quick.
Yeah. Okay.
Ali, put the timer, please.
Time is already on.
Start.
Right. So, hello, I am Dr. Sahar, one of the surgical doctors. Can I please confirm your name and age?
My name is Mariam Muhammad. I'm 30 years old.
Hello, Ms. Mariam. Can I please know what brought you to the hospital today?
I have a back pain.
Oh, I'm so sorry about that. Can I offer you any painkillers? Okay. So, to make
Can you raise your voice, please, Sahar?
Okay. To be able to reach a diagnosis and help you with your discomfort, I need to do some tests that will involve me looking, feeling, and touching you in some areas and doing some special tests. Is that okay with you?
Yeah.
Okay. And I need your permission for exposure. Is that okay? Do you need a chaperone with us? Okay, Ms. Mariam. Ms. Mariam, can I ask you, so I inspect the surrounding for any walking aids. Ms. Mariam, can I ask you to walk across the room? Don't worry, I will be beside you if you need me. Okay. Okay, would you come back?
Please come forward.
Where? Which heel?
Right.
Oh, I'm so sorry about that. Do you need some painkillers? Okay. Ms. Mariam, I just need you to just step aside here, okay? Because I need to move around you, okay? I'm just going to look, okay, for any curvatures, for any scars, for any abnormal hair growth. Okay, Miss Miriam, now I'm going to be touching your back. If you have any pain anywhere, anytime, let me know. So we're looking at the patient from the side and touching the spine, spinous processes, the paraspinous muscles. Okay, Miss Miriam, I'm just going to put a mark on your back. Is that okay? Okay. So detecting the posterior iliac spine, superior posterior iliac spines in the middle, I will, with the measuring tape. Okay, I need you to touch your toes for me as much as you can. So 5 centimeter below the point and 10 centimeter above. Can you please bend down, Miss Miriam? Okay, so it's 16. Is that okay? Do you feel pain?
Little bit.
Okay, you can come back. Thank you. I'm just gonna, these marks, I'm gonna rub them off later on, okay? Miss Miriam, I just need you to do like me. Can you bend like this? And can you go back like this? And on the sides, like this, and like this. Thank you very much. Miss Miriam, can you please lay down? Lay down for me. Miss Miriam, do you feel this? This is a piece of cotton.
Yes.
Okay, I need you to close your eyes and let me know if you feel it. On the places I touch you. You feel this?
Yes.
You feel this the same?
Yes.
You feel this?
Yes.
You feel this the same?
Yes.
And here,
Yes.
and here,
Yes.
and here,
Yes.
and here. Okay, very good. Now, Miss Mariam, I'm going to also using the pinprick, or should I just skip it?
Skip it.
Skip, okay. Miss Mariam, now I'm going to just examine the power of your organs. I'm just going to look at the temperature. Okay, I forgot the temperature at the back as well. Now, Miss Miriam, I'm just going to put my hands below your knee, and I need you to raise your, stop me from lifting your legs off the bed. Okay, very good. Now, please lift your leg and stop me from pushing it down. Okay, very good. Can you do it with the other leg? Yes, and here. Okay, very good. Now, Miss Miriam, I need you to push your, like you're pressing the bed up. Yes, and this one. The here, point your toes towards your head. And here. Very good, Miss Miriam. And please bend your knees. And stop me from straightening your leg. Okay, now please push your legs down and stop me from straightening it. And the other one, bend please. Here and here. Thank you very much. Now, Miss Miriam, I need you to run your right heel over your left shin. Repeatedly, okay? And over again. Lift it and do it again. Okay, repeat it. Lift and do it again. No, lift it and do it again. Lift it, run, and lift, and do it again. Okay, thank you very much. Now, Miss Miriam, I need you to just bend your leg like this, and this should be 90 degrees. Now I'm going to just push it suddenly, okay? Sit for clonus. Okay, Miss Miriam. Miss Miriam, now I need to please lift your leg as much as you can. Straight, keep it straight. Do you feel pain?
Yeah.
Okay, sorry. So I'm just gonna step by step to lower it down. And dorset legs. Do you feel pain at the back of your thigh? Okay, so this is the angle. What about the other one? Straighten, please. Pain? Okay, thank you very much, Ms. Lillian. Okay, now I'm going to dress you up, and if you, I'm going to remove the marks.
Time finished, Sahar. Time finished. You've got 30 seconds. Do you want to do anything? Time finished.
I would examine the lower limbs, neurological examination for the lower limbs and the spine.
Okay. Can you present your patient?
It's Miriam, who is a 30-year-old female who came in with lower back ache and the lower limb pain, the right limb. On examination, she had a the gait was normal, and she had tenderness over the lower back and on the heel while walking. The Schober test and the straight leg test were positive on the the straight leg test was positive on the right side, and so giving suspicion or raising suspicion of sciatic nerve involvement. My differential will be lumbar strain or early degenerative disc disease or a
All right.
referred pain like sciatica.
And you basically mentioned the most common causes of the lower back pain.
Muscle
Yeah.
pain, yeah.
Okay. And how will you investigate this patient?
The lumbosacral spine, anterior, posterior, and lateral views, and an MRI of the lumbosacral as well.
All right. And what's your management plan, doctor?
Initially, I'll start with the conservative management in the form of physical exercises, non-steroidal anti-inflammatory drugs, and lifestyle modification.
Okay. And if it's persistent?
Yeah, for persistent procedures like steroid injections, epidural steroid injection, and in severe cases that don't respond to the injection, I could go further with microdiscectomy or laminectomy based on
Okay.
the
Based on specific studies, yes. If your patient has a history of chronic steroid use, how would that influence your management?
I'd be careful with using steroids in such a
Time
patient.
finished? Time
or
finished?
bone health. Okay.
But I will let you answer the question, yes?
Yeah, I'd be careful in using steroids in such patient or due to the poor bone health in this patient because of the use of steroids and possibly the delayed healing after surgery. And additionally, I will I will have to liaise with his GP or her GP for the management of steroid complications.
Yes, because there are so many complications of the steroids and you need to taper it down, right? Good.
Right.
Good. I think it's a very difficult station, to be honest. Backache and spine with the neurological. I just have a quick, and I want to ask Muhammad too, because he had his exam very recently. You know, she said she will do the spine. I think she was supposed to, firstly, you're gonna pass for sure. The spine examination should be as a start, right? Before the lower limb examination, neurological examination.
Yes,
The first thing,
as you said,
Yeah.
the spine is long station. So it is crucial to do
Yes.
the special test of the spine immediately after looking and feeling a movement of the back. Put the lower limb examination after the special test.
after.
Yes,
Yes.
because the special
Yes.
test here will provide you the diagnosis. Is it sciatica or femoral nerve compression?
All right. Sahar, what do you think? Do you think like you delayed the spine examination, the palpation of the spine, the looking of the spine, the
No,
temperature?
he did all that, Ali. She did all that. But
I did.
she
Fine.
did
Yeah.
all that, but she forget the femoral stretch test.
Yes, I forgot that.
Yes. So
All
my
right, femoral
advice
stretch,
to
yeah.
do the special test after looking, feeling a movement immediately. Put the lower limb
Okay,
examination at the end.
Okay.
Okay. Yes, and
Do you have anything you want
yes,
to
yeah,
add?
Muhammad.
In looking,
No, I just wanna. Okay, so Muhammad, I think we need to make a school the same way we want them to do it, right? So we should put a special test.
yes,
in the school after
put
the
it.
look, feel,
I
and
put it at
move,
the
right?
beginning.
No, it's after the lower limb examination.
Okay, I'm really sorry. So
No,
Sahar,
I'm gonna I'm gonna revise it now. I'm gonna
You-
change it now.
All right.
Yeah, Muhammad,
You
continue.
introduce yourself, take permission, and offer a painkiller. In the look, you look to the patient in all direction. I wanted to ask you, did you ask the patient, is she use any walking aids?
No,
No.
I didn't ask, but I looked while inspecting. I
Yes.
looked at the surrounding if she was using
But
any aid.
It will be any side, in any side.
Yeah.
Yeah, she
So
said,
you
she
need to ask
mentioned this point, Muhammad. She said, I'm looking for any point.
Walking
I'm looking
aids.
for
Yes, regarding the explanation during examination, some examiner don't accept that. I will do 5 centimeter above and 10 centimeter below, but it will be fine if you direct your words to the stimulator, not to the examiner.
Do you understand this point? So, okay, Sahad, you don't need to explain every single point you're doing to the examiner. When
Okay,
you
I
take
just
the
perform,
when you
so I
take the
don't.
test,
Yeah, I
you
don't.
take-
Okay.
sorry.
Yeah, I just do a perform, but I don't.
Yes.
explain what I perform.
Explain to the
Yeah,
patient.
Okay.
this is the tape. I'm gonna measure your back, and then I want you to lay down. I think you just went into more detail by saying 5 centimeter above and 10
Yes.
5 centimeter.
Okay.
5
And
centimeter
feeling,
below.
Below, 10 above, yeah.
yeah.
ما هو
That's
just
the- that's-
عشان the
that's
sake
more-
of the other.
That's a detail your patient doesn't need to know about.
Yes.
Okay.
Sahar, in
I
feeling,
change it now in the school, Muhammad.
Yeah,
Just
okay.
gonna follow.
in feeling, you forget the temperature.
And
I didn't notice
After-
that you miss the temperature, but you mentioned it.
After you finish, Muhammad, yes.
So
Continue.
if you miss any point in the examination,
The temperature, I
Don't
did it
mention
for
it.
the lower limbs, but I forgot for the
don't
spine.
mention that you forget checking the temperature.
Okay.
All right. In the movement, I think you forget the cervical spine movement. You need to ask the patient to bend his head forward and backward and lateral flexion.
Okay.
You
Did
just-
he?
No. Also,
No, I didn't
I
do
think
cervical.
it is irrespective or imperfect if you ask the stimulator to bend his back forward twice. When you're doing movement, do the chopper test with flexion of the back at the same time. So you can
Okay.
check the chopper and flexion test.
Okay.
All right.
All right. Very good. So did you take note of the mistakes? The femoral stretch test.
Yes.
After the spine, you immediately go to the special test. We change the school now. I think also you took a lot of time in the coordination, Sahar. You want to show the examiner. You are acting. You want to show the examiner. You didn't forget the coordination. Ask the patient to take his heel, move it on the shin, on the other leg, and do the opposite.
Well, I explained this, like, I think she forgot how to do it, so she took a long time. Yes.
If you miss any point in examination,
Probably.
before present your case,
Yes.
say, I would like to complete my examination by checking the coordination and by doing a full neurological examination and so on.
Yes. So if the time we're not able to help you with couple of stuff you think important, then you need to mention it. I would like to complete my examination by doing this and this and this and that before you go to the discussion.
So the full examination, I should go a joint above and a joint below. So that would be the for the
Yes.
spine on lower limbs, and what's above.
For the hip is gonna be the spine, which you already do. You're doing the spine, right?
Yeah.
The spine is gonna be the cervical and it's gonna be the hip joint.
Okay.
But you just acting, you're just gonna mention it. I would like to complete my examination by checking the cervical spines and checking the hips, but you will never find time. You will never find time even to complete the BOA, by the way. You will never find time to complete the lower neurological examination. There's no time for that.
Asia,
Just one
Just
question,
give-
one question, Mr. Ali.
Yeah.
He said that you said examination of the joints above and below.
Okay. Above
This
and below
one,
is
this
the,
one for all the station,
For
either
all
for the
fabric
knee.
examinations.
yes. It's
For my station
Muhammad.
knee examination, should I set also hip joint and
Ankle.
ankle joint?
Yeah.
Or
Yes.
no need, no need.
Yes.
No, you say it. You can say it, which is better, because
I have
from
last
real
point for Sahar. Okay.
for
Complete, Ali.
me, Muhammad. Before give me a second.
Continue.
I never said it, and I passed the exam, and I always forget this one. But it's better to mention it. I would like to complete my examination by doing the knee, the joint above, which is, and the joint below. Or I would like to finish my examination by checking the hip if you are doing the knee and the ankles. But you never find time to do that. You just mention it to the examiner, so the examiner is aware. Where did this information came from? I don't know, but it's just circulating between students.
Okay.
But logically, I have no explanation for.
Okay.
I
So
have
no
last
need,
point
no
for
need
Sahar.
to mention in the school. No need.
No, I will mention it now.
Okay.
I'm gonna add it now,
Okay.
even for your station.
Okay, thanks.
Sahar, as we said, this is a long station, and I appreciate that you do sensation before any tune and power, because sensation here is the important point.
The sensation is mentioned first.
Yes,
I just
Yes.
followed.
excellent. The
Because
next
sensation is more important than tone, by the way.
yes.
Tone
The
is
next
like
session is shoulder joint examination.
now. Yes. So we need to add to school, Muhammad. I would like to examine the joint above and the joint below
Yeah, I would like to complete my examination.
for all station.
Yes. Shoulder joint for Alia Hassan. Alia.
Yes.
All right.
All right. Are you ready?
Yes. Can you
Shoulder.
start?
Please let us put a timer. Ali,
Yes.
put a timer.
Time is Z. Yes.
Start, Alia. Ali, mute yourself, please. Muhammad Kamal, mute yourself.
Already muted, muted.
Yes, Mr. Ali, 55 years old. Nice to meet you, Mr. Ali. Today I have been
Raise
asked
your
to
voice,
examine-
Alia.
Today I have been asked to examine your shoulder joint. This includes from me looking, feeling, and moving, and do some special tests. Is that okay with you? Yes. For the purpose of examination, I want to take your shirt off and keep your dignity. Is that okay? Yes. Do you want painkiller? No? No? Okay. During the examination, if you feel any pain, please let me know. Okay. I will take a I will now I will look take a look around you. Okay. Okay. Like inspection. Be in your back. That's okay. Okay. Thank you. And now I will feel you. You have any pain? No, right now, no. That's okay. I will this is your rheumatoid joint. Clavicle, from your clavicular joint, and this is the humerus. Okay. And I will palpate your rheumatoid. Okay. Now, for the other clavicular joint, clavicle, acromioclavicular joint. Okay. Now, you feel in this chair. Now I want you to move your arm. Okay. Can you raise your arm forward like this as far as you can? Okay. Relax. and backward as far as you can. Relax. Away from side as far. Okay, relax. Cross your front like this. Okay, thank you. Now bend your elbow like this and do like this. Okay, and like this. Okay, thank you. Now I will repeat all this movement. Okay, we'll start from normal side. You have pain? Right now, no. I will be gentle with you. Extension. Abduction. Abduction. Rotation. You have any pain? No. Okay. Now I will examine your muscle power. Can you do like this? And press against my hand. Okay. And press against my hand. Okay. Thank you. And now can you do like this? Okay. And don't let me to push you down. Now I will lift your arm. If you feel pain, please inform me. Point your thumb down. I'm sorry. You need any painkiller? No. Thank you. Okay. Can I proceed? Yes. Okay. Now I want from you to put your hand like this. Okay, and press against my hand. I'm sorry. Okay. Now I want from you to push the wall. Thank you. Now can you sit? And shrug your shoulder. Push against my hand. Okay. Yes. Thank you, Mr. Ali. Now you can redress. You need any help? No, thank you. Thank you for your time.
How many time remained, Ali? How many minutes?
50 seconds. 50 seconds remaining. 50 seconds. Do you want to do
need
anything?
to or mention anything?
Nothing.
All right. Can you present your patient, please?
Okay, I examine Mr. Ali, 50 years old, present by right shoulder pain. Patient have history of old trauma in same shoulder. On examination, patient have right shoulder scar, normal temperature, no tenderness, less restrict in movement in all motion of the right shoulder. And my main differential diagnosis is a frozen shoulder.
All right. What do we call the frozen shoulder? What the other name of the frozen shoulder?
Okay, adhesive capsulitis.
All right. What is the adhesive capsulitis?
Shoulder pain for more than 3 months. This inflammation results in stiffness of the shoulder, result in scarring of the shoulder joint capsule, lead to stiffness and limitation in movement, especially abduction. External.
Do you know the stages of adhesive capsulitis?
Okay, stage 1, freezing stage. It is painful. There's limitation in movement. Stage 2, frozen. There is painless and also this limitation in movement. Stage 3, thawing stage, and this is also painless stage, and there's improve in range of movement in this stage.
All right. Do you know the timing of each stage, or you forgot them?
Okay, stage 1 starts 6 weeks to 9 months. Stage 2, 4 to 6 months. Stage 3, 5 months to 2 years.
With variation, that's fine. What is the risk factor of primary adhesive capsulitis?
Okay, it could be diabetes mellitus, between disorder, Parkinson's disease, and thyroid disorder,
Fine,
and it could be.
that's okay.
Okay.
How will you manage adhesive capsulitis?
After radiological image, X-ray and MRI. After that, blood investigation and inflammatory marker. Then I will start by simple analgesia and non-steroidal and corticosteroid and physiotherapy. Also, it could be arthroscopy and shoulder joint manipulation and then anesthesia.
All right. And that's okay. Do you know the difference between intrinsic shoulder pain and extrinsic shoulder
It
pain?
could be due to rotator cuff disorder, and this is rotator cuff tear, maybe a acromioclavicular joint disorder, the arthritis, glenohumeral disorder, the frozen shoulder, or osteoarthritis, and could be biceps muscle tendinitis, and could be trauma. Fracture and external maybe pain refer from the neck or myocardial infarction or diaphragm in subphrenic abscess or gallbladder pathology, and also it could be malignancy as apical cancer or metastasis, and could be. Yeah.
Good. Very good. I will start with Muhammad.
Alia?
Very good presentation and examination.
Yes. This is the tough.
Yes.
This is the tough examination station. You did it very good. Just I will go through examination from the introduction. You introduce yourself, take permission, and you start by looking from all direction, and you do feeling. You did feeling. All sides need to examine the tenderness and the movement. You did it all. Active and passive. I think my connect is poor. Ali, do you hear me?
Yeah, I can hear you. I'm gonna carry on. What about temperature, Alia? Did you check the temperature?
Yes. Yeah. First, I forget after tenderness. I remember, and I did after tenderness.
After tenderness, okay. And I like the way you ask for permission before you go to the back. So you took a permission before you go and check from the back. On the presentation, you said I examine instead of I examine. Yeah, Muhammad, your international back. Yeah, continue.
Yes, I appreciate. Also, she asked about, are you able to continue after patient experience pain in his shoulder? Also,
yes.
You put your hands in shoulder of the patient, so you need to check is there any or feeling is there any crepitus or not. All time I see you put your hands in his shoulder. Special test, scarf test, and subchromial impingement test. You did it all, but I would like to make this shoulder joint examination is easy. How? As any orthopedic examination, start by look, feel, movement, then forget the special test and check the muscle. Start from above, which is a trapezius muscle. By ask the patient to shrug his shoulder, and then serratus anterior. By ask the patient, could you press against the wall? Go smoothly through the muscles from above downward, subscapularis, infraspinatus, anterior minor, which will give both action, and supraspinatus. Then go to the special test.
Okay. But just at the end, just say I examine instead of I examine, okay?
Also,
and say gentleman. If you forgot the name, that's fine. Just I examined this gentleman. He presented with this and that and that.
Also, I see
this
you
question,
explain to the patient.
Yes, and I can tell you really studied the school. This Muhammad, in this station, all these are our new questions, right? I don't think they are in the other resources. What do you
Yes.
think?
There are 2 questions.
Yeah.
Yes, I updated, I think, 2 weeks ago.
The stages, stage 1, stage 2, stage 3, and the difference between intrinsic shoulder pain and difference between extrinsic shoulder pain. Is there a new question?
No, just I update the times, which freezing will took 6 weeks to 9 months. That's already
Yes.
found.
All right. Okay. Good. We finished the orthopedic right now. This is all the orthopedic examination.
Yes.
We are
This
done
is
for today.
6 examinations.
Yeah, I just want to ask for the rest of the people here. So this video is recorded and it was us. What about uploading this video just for you guys? Nobody else will allow to see them. It's not like the rest of the videos, which we will later upload to different places, like YouTube. But this is just for you in the community group, in the except you.
It's okay with me. I will just verbally and I will write it also.
That's fine. And for the rest,
But
Yeah.
missing points, I hope yani, after each examination, you mentioned the missing points.
missing points.
Yes, so
In the
I
school, you mean?
What do you mean, Sahab?
In the school, you mean?
like the temperature, the femoral stretch test I didn't do. So all these missing steps I didn't do, we should mention that they're missing from the video.
No. You didn't get what I mean. This video will not be uploaded for no one. We're not going to use this video for studying as a studying material. We're going to use the rest of the videos as studying materials, the communications, the history. But this video for you, I want you guys to go and review yourself. That's
think,
why I
Ali,
want to upload it.
So
Yeah.
okay.
Ali, my opinion, do not
No,
upload this
I don't-
video.
my what I'm saying is our group should see each other's examination to benefit from them. For example,
Yes.
Yes.
never seen shoulder examination until now.
Yes. So Muhammad, these videos, like just the 10 people who are allowed to have an access to the August course will see the videos, and immediately after August we will delete them or we take them out.
By that,
It's
you
not
mean
for-
I would like to make a new group for these 8 people who can see this video. So in the school, it's public for everyone.
No. The school not public. Not public.
17.
No. In the school, nobody else beside
You
our
mean
people
you will
can
provide
go-
access
nobody-
for all?
Muhammad, nobody's allowed to go to the August 2024 except those who we gave access. August 2024, nobody's allowed to see this session.
Yes, you mean 17.
No, I don't mean the group.
Participants. Yes, on August
Yeah.
17.
August 17 are allowed to see yes, the August 2024, but nobody else is allowed. It's not like the communication or the history or the rest of them. Okay, that's fine.
We need to discuss this more, Ali.
Okay, I'm listening.
No, private, I think.
Okay.
He's talking to you privately, my friend. You and him.
Okay, that's fine. Let's see. All right. Any question?
No, it's appreciated for your teaching.
That's very good. That's very good start.
Thank you
Thanks a
for
lot.
participation.
For the next week, well, the next session is on 23. We have arteriovenous fistula, peripheral vascular examination, gynecomastia, superficial lump, lipoma, parotid gland, and
Varicose vein. Yes. We'll do this all in one session.
Yes, we'll do all. They are not a lot. 1, 2, 3, 4, 5, 6, 7. Just prepare yourself for the next session.
Salma
I think because
Zahran,
there is one,
Al-Fatih, be ready for the next
one
session.
station miss. One station miss from the last session. I think there is acute limb ischemia. You said that you are in a hurry. You are traveling.
Oh, yes.
That's why I ask you. You want to do it all? That's my question.
Acute limb ischemia in history station or in examination?
It was in the last session. He is about to leave in the train, and he was arguing with you. He cannot attend.
Ali,
I
acute
don't
limb
remember-
ischemia, I think we did acute limb ischemia because it's a vascular examination.
There's
I don't
two
know, but there is
acute-
some kind of miss. There is some miss station there.
Yeah. There's 2 station acute limb ischemia from what I see.
Ali, we did
Yes.
it. We did it. You can review it from the school.
Updated head trauma, acute limb ischemia. Okay, so then why yesterday we said we didn't do it?
Because there is argument about 2 acute limb ischemia. I don't know. I have seen only one in the school, but you said there is 2 acute limb ischemia. I don't know. One of them with the diverticulitis.
Acute limb ischemia in the phone call, Muhammad Kamal.
Yes, I told you that.
Phone
Yeah.
call, and he said Asia will start with the station, and then we will go on with the examination.
No, but what did we miss?
Ali.
Muhammad, wait.
Please wait.
So what did we miss? Hello,
Muhammad Kamal asked about
Yes.
the acute limb ischemia. There are 2 stations of the acute limb ischemia.
but there's
Yes.
one in the school. There's one. I don't see 2. There's one
In
in
the-
the
In the phone call, there are 2 acute
Yes.
limb ischemia,
one. I
Which
can
is-
see one.
which is the head trauma and acute diverticulitis. Trauma head department.
Okay.
Yes, my friend. I totally agree with you. But you said this is the word had been said. You said 2. That's why I was angry. Where is the other one?
Ali, you said that?
I think
Yes.
Dr. Saleh said something
can
about
I-
this.
Can
Someone
I
said
just
something.
give you information about what you're arguing about?
Okay.
Yeah.
I'm sorry. My station was acute limb ischemia, which is the one with acute diverticulitis. I should have done it
Oh.
yesterday, and you postponed it for today. But I need to apologize because I'm having an asthma attack. It will be a little difficult for me to.
All right. that's fine.
Now I
So-
understand. Now I understand. So
Yeah.
the missing
So-
station is acute limb ischemia with Asia.
Okay, we're gonna do it. We're gonna do it on 23. Before Muhammad, please, Muhammad Kamal, please
Yes.
remind us before we start the meeting. So we're gonna
Okay.
do the acute.
Say. What note
Yes.
do you want me? Say the notes so I can remember.
Acute limb ischemia on 23. We're gonna start with it before we go to the examination.
Phone call.
A phone call, acute limb ischemia phone call. It's on the school. This
Okay.
one. Let me show you so everyone can see. Give me a second. This
I
one.
misunderstood you, Muhammad Kamal.
This one.
I think
This
you
one.
said about examination. Really
This
sorry.
one.
No, my friend. Because he was in a hurry and you are trying to do it. That's
Yeah,
why.
Okay. So remind me of this. Everyone remind me of this, please, next week. Not next week, on 23. Okay. Good luck, everyone. See you on 23.
Okay. Bye-bye.